Do you have frustrating low back pain that just won't seem to go away no matter what you try? If you do, you may have tried stretching or painkillers, but if we don't address the root cause, stretching is not only going to potentially make it worse, but you're going to be wasting your time. Instead, the quickest and most effective way to address low back pain is to strengthen the muscles in your spine and get motion back into the spinal joints that are responsible for that pain. What this will do is it will help retrain your brain and your body to understand that movement is safe and get you on the road to health and healing. From here, your body will understand that it is safe to move and you can start to enjoy life again. So in this video, I'm going to show you the 3 simple movements I do every single day to help make sure that my back and my spine are ready to move pain-free every single day. Hi, I'm Mike. I'm a chiropractor and a master's of science in exercise, and I help people get out of low back, hip, and knee pain. It's all I do. So let's get to the exercises. But first, here's a quick disclaimer. All right, so for this first exercise, what we're going to do is we're just going to stand in a comfortable place. We're going to try and get blood flow into the low back. One of the key issues with low back pain is that it is a result of just not having enough motion and compressing the spine too much with all the sitting that we do and just overall lack of motion. So the first very basic step that we need to take is just to get blood flow back into that area, to get synovial fluid moving in our discs again. So how we're going to do that is we are going to, even if we have low back pain here in this area and it hurts to bend up and pick up something, what we're going to do is we're going to very slowly go only to the point that we potentially start to feel some pain in this area, okay? So we're not going to go quickly because that will potentially cause a flare-up of what we're feeling, all right? But what we want to do is stand feet kind of shoulder width apart, just like this, and then slowly bend forward until we start to feel maybe just the very beginning of whatever pain we're feeling, okay? From there, once we feel that, that's our limit, so we can even back off from it just a little bit. So let's say our limit is here before we start to feel something. We would then just come up a little bit, and in that range, that safe movement range, we're then going to reach up slowly up here with our arms, and then reach up with the other arm, okay? So you notice what this is doing is this is just activating some of the muscles in that area, while also getting some gentle motion back into this part of our spine, okay? So we're just gonna do that. We can do each arm motion 10 times or so, just like this. And while we're doing this, what this is doing is this is bracing the core and activating the muscles that keep our spine stable. So while we're causing motion in this part of our spine, just like this, we're also activating and telling the little muscles in our spine that keep our spine stable that it's okay to work in a range that is safe for them, okay? So hopefully that makes sense. So once we've done 10, we can come slowly up, just like this, and then we'll move on to the second low back exercise. Great job. All right, so for the second exercise, we are now going to go either onto the floor, or if you have trouble getting onto the floor, we can go onto a bed or a table, just like something I'm on right here. So we're gonna go onto all fours, and what we're going to do is we're going to introduce gentle motion, both in a forward direction and in a backwards direction, okay? So I'll just demonstrate here. So we're going on all fours, just like this. And from here, we want to start kind of in a neutral back position. Of course, we want to remember that we only want to go as far as we start to feel some of the pain that we had been feeling before. So we don't want to go all the way up if that's going to cause pain in the area that we're feeling it, okay? So we just want to start here. We want to slowly go up. And then if we start to feel pain in this part, that's totally okay. We want to back off from that and then slowly go down opposite that pain and come all the way up just like this. So we see how we've kind of gone downwards. Our spine has gone down towards the floor or the bed here. And then we want to slowly round back up. But again, only up to the point where we start to feel pain. Once we feel it there, we can stop, hold for a minute, and not for a minute, sorry, for a second, and then come back through here. So this exercise is called the cat camel exercise. So cat camel. So if we start to notice that we can go further as we do it a couple of times, that's also okay. But again, we want to be slow and controlled. All right, so we want to do this anywhere from 8 to 10 times each up and down. So that'd be like 16 to 20 times total. Nice and slow. And what this is doing is getting that motion again in our core, in our back. We're just getting gentle movement, because the first key step of getting health and safe movement back into our spine and in our low back is just to do movements that are safe and teach the spine that it's okay to move and that we don't have to be afraid, okay? All right, so once we've done that, done it 8 to 10 times up and down, we can move on to the third exercise. Great job. All right, so for this third exercise, what we're going to do is we are going to do a combination of gentle motion, opening up the hips, the pelvis, and the low back. There's going to be a little bit of stretching in this exercise inherent with the movement, but our focus isn't to try and stretch to just stretch the muscle. What we're doing is we're trying to introduce gentle movement, and with that, our muscles will hopefully start to release, and that will just cause pain relief instead of just blindly pushing straight through into stretching, which can cause a flare-up of the pain in our low back that we're feeling. Okay, so what we first want to do is, as best as we can, we want to bring the side of the back that is hurting the most, we want to bring that leg up onto our knee just like this. This is called the figure 4 movement. Some people call it the figure 4 stretch if we're going for a stretch, but it can also just be a place that we're doing a movement for this area, okay? So we can bring our foot up here. If it is hard to bring your foot up, you can also put it lower down. So if you can only get it up to this part of your leg, you can get it up to here because you're restricted or whichever, totally okay. But what we want to do from here is have a straight back, okay? We want to kind of have a good posture, not rigid, just not slouching, okay? So we're up here, and then what we're going to do from here is we are going to, while keeping our chest out and our low back straight and our upper back straight, we're going to slowly lean forward into this movement. And then what we're going to feel is a gentle release of tension in the glute area, in the hips, and that's what we're aiming for, is just that nice release, okay? So we're gonna go up to, if we have a point of pain where we again are starting to feel whatever we were dealing with prior to this video, we'll just go up to that and then we'll back off nice and slow, okay? We can also do a version of this, I'll show you on the side. If you want to support your leg on the table, you can either do it facing the way I was facing, or you can support your leg right here on the table and just lean into it like this. So do you see how my back is straight? My low back isn't rounded. We're not doing like this because that's encouraging motion in the spine without it being controlled. We want to engage our core, puff out our chest a bit, and lean nice and slowly forward. And that's where we're gonna start to feel a nice controlled initiation of movement in our low back and in our pelvis, okay? So nice and smooth this way, and coming back all the way up, and we'll go down and do it again. Good. Now we can do this 8 to 10 times on the one leg, and then if we want, we can switch legs. If that was enough motion and you're a bit tired after 8 to 10 times, that is totally okay. We can just do the one side, but over time, we eventually want to get to a place where we're doing 8 to 10 movements on each leg so that we're getting our whole pelvis, both our left and our right side, and our low back, both sides, we're getting that motion in it. All right, so once you've done that, we are done all 3 exercises. Great job. So just a few quick cautions to go over as we navigate these exercises. So if while you're doing the exercises, your pain either gets worse or it changes in character. So let's say you had like a aching pain in your back, and then you started to do some of these movements and it changed to like a burning or a stabbing pain, that would be a good sign to go and see a trusted health professional in your area. As well, if maybe you were dealing with some sciatica along with your low back pain and it was only down one side, but then it started to change and go down both legs or even into your groin, that would be a sign that you should go see a trusted health professional as well and get checked out. Now, if you were feeling pain down a leg or away from your spine, and after doing these exercises, that pain started to move closer to the spine, that's a good sign that your body is getting to a safer place of movement and that the pain is progressing in a way that your body is healing. This is a concept known as centralization. So again, if it's kind of started to move from further away and starts to go more towards the center, that is a good sign that things are moving in the right direction. The other thing we don't want to do, and I mentioned it earlier in the video, but we never want to push through any pain. Basically, with any movements that we do, we want to only go up to the point that we start to feel pain. And then once we kind of hit that early part, that is our sign that that is our limit for the day. And over time, as we build up resilience before that pain starts to happen, our body will slowly build up a better tolerance. And that will be the best way to move forward sustainably. We never want to just leap into something and risk further injury in that regard. All right, thanks for watching this video. If you want to see more exercises just like this, I have a free group where we go over mobility training and strengthening exercises. We also have nutrition guides and a great community of people who are looking to continue moving pain-free for life. So if you want to come join, click the link in the description. We'd love to see you there. And if you want to see more low back pain specific videos, I have this video here where I go over more low back strengthening exercises that help tackle the root cause of low back pain. Click here for that video. All right, thanks for watching. Hope to see you in the next video and have a great rest of your day. Thanks.